Last week was designated Antimicrobial Resistance Week, and landmarks across the country, including here in Niagara, were bathed in blue light to mark the occasion. Dr. Karim from Niagara Health and pharmacist specialist Brad Langford joined the source. Brad, begin with you. Why is this such a concern?
Well, antimicrobial resistance is a concern because it's really undermining the modern healthcare system. As much as 25% of infections in Canada are now resistant to antibiotics. And what that means is that these bacteria are developing ways to fight off the antibiotics and can make infections much harder to treat.
Is this because doctors have been over-prescribing antibiotics when they don't need to be?
So overprescribing is a very common reason and driver for why antimicrobial resistance is increasing. So if we use antimicrobials more judiciously, we can help to reduce the increases in antimicrobial resistance that we're seeing.
Dr. Ali, this is a problem not just here in Niagara, but across the country, probably across the world. What is being done at Niagara Health to battle this?
So, just giving it a global context, WHO has declared antimicrobial resistance as a global health threat, one of the top global health threats. Each year, millions of lives are lost to resistant bacterial infections. In Canada, if we speak, during the year 2018-2019, about 15,000 lives were lost due to resistant bacterial infections.
And this is something that could have been avoided, correct?
It could be avoided, and that requires a much more multi-pronged approach because it's not just antimicrobial resistance in humans, right? So we talk about cattle, right, like antibiotic use in cattle, in plants. All of this comes into play with the with the ecosystem that we have in this
So
in the world.
We eat chicken that is raised on antibiotics, that gets
Exactly.
into our systems.
Exactly.
And sometimes we don't even know it.
We don't even know it. So all of this contributes towards development of antimicrobial resistance. And one thing, like Brad pointed out, a very important thing that we can actually target is antibiotic overprescribing. There are some studies to show that about 30 to 40% of prescriptions of antimicrobials are unnecessary. And that speaks to the importance of how antimicrobial stewardship programs all across are trying to make a difference and have actually made a difference.
Brad, you're involved in one of these stewardship processes at the Shaver Hospital here in Niagara.
That's right. I work at Hotel Dieu Shaver as part of the Antimicrobial Stewardship Program, where we work with prescribers, physicians, pharmacists, and nurses to help use antibiotics more appropriately.
What else needs to be done, Dr. Ali?
So amongst the things we can do, most hospitals now, right, like it's actually a required practice by Accreditation Canada. Hospitals do require an antimicrobial stewardship program. And it's a more collaborative approach, right? Like nobody succeeds in any plans coming in guns blazing. You need to do as I tell you, right? So all of this antimicrobial stewardship program that we do, we sit down with the prescribers, we go over the prescriptions. The antimicrobial stewardship program at Niagara Health is in its 10th year now. So we will be completing approximately 9-10 years with remarkable results. We sit down with prescribers, we go over, what the appropriate antibiotic is and what the duration of this antibiotic is. And if I may quickly say one thing that we can do
Cold
during
and flu season, right?
This cold and flu season, cold and flu viruses do not respond to antibiotics. There is a role for antivirals that can be discussed with your GP, your provider, but antibiotic use in cold and flu season is one of the big drivers too.
Brad, where can people find more information about this coalition that exists and about antimicrobial overuse in general?
Yeah, there's a great website called antibioticawareness.ca. So it has lots of resources and information, both for prescribers, healthcare professionals, as well as for the general public.
Brad, Dr. Ali, thank you for joining us and shedding light on this very important public health issue.
Thank you.
Thanks for having us.